very sorry, sir. The doctor has confirmed that you have a bacterial bladder infection, and we do not have antibiotics available in the United States that will treat it because it is resistant. Unfortunately, there is nothing we can do. We will make you as comfortable as possible and begin hospice care immediately.
Can you imagine a world where antibiotics don't work? This man is dying of a simple bladder infection. How trivial. Are you serious? Imagine that. I can't imagine that. Sadly, this world might be a lot closer than we think. Hi, my name is Cassandra, and today I'm here to tell you why antibiotics are harmful for our bodies, and I am here to persuade you that we should not be using them. I have 3 points that I would like to make to explain and persuade you that they are not working. 1, because we are creating superbugs that are resistant to medications. 2, because they are expensive and we are wasting our money. And 3, because the risks are far outweighing the benefits most of the time. So let's start with my point number 1. Superbugs are illnesses, bacteria, that are resistant to antibiotics, especially the antibiotics that we usually use to treat that. MRSA is an illness that is resistant to antibiotics, and according to the Washington Post, kills about 23,000 Americans a year and sickens at least 2 million. That's sad. One of the problems is that patients are taking the antibiotics and they aren't taking the entire prescription because they feel better after taking part of the prescription. They throw the rest away and stop taking them. However, yes, you feel better, but the bug is not gone. It's weak, which is why you feel better. However, it's not gone, and now it's able to build back and now resistant to the antibiotics. The second part of why we are recruiting superbugs is because farmers are using antibiotics. I have this meal here. It's Southwest chicken freezer meal. And did you know that this actually has antibiotics in it? Wait, what? Yeah, it has antibiotics in it. I would be consuming antibiotics if I eat this meal. According to the Washington Post, about 80% of farmers, about 80% of the antibiotics bought in the U.S. are actually bought by farmers who are feeding their animals to make them healthy and make more money. Like I mentioned earlier, with patients not consuming the entire prescription, well, the exact same thing is happening here. We're consuming these antibiotics, but not enough to kill the bacteria, just enough for them to become resistant. And we are creating superbugs. Now that I've told you why we are hurting the environment with all of these antibiotics, I would like to tell you why we are hurting our wallets. Antibiotics are incredibly expensive. They may not seem so at first, but the more you use them, the more expensive they get. According to the Eagle Tribune, it is estimated that as many as half of the antibiotics given out by doctors are unnecessary. Most of the time, or as much as half of the time, doctors are handing out prescriptions that aren't going to work. I go into the doctor because I have a sore throat and I ask for an antibiotic. He gives me one. It doesn't work. There's some money wasted. So I go back. He gives me more antibiotics. There's more money, and more money, and more money, and more money. All my money's gone, and I did not find a cure. This is what's happening when we're going in and asking for antibiotics, especially when we don't need them. For example, a sore throat, or an achy ear, or a stomach ache, where we don't actually have an illness. Our body is just trying to fight something off. Let your bodies fight it off. And that leads me to my third point. Why antibiotics are harming our bodies. The benefits are usually not worth the risks. Sapiro is an antibiotic that is used to treat certain infections. And according to the WebMD, Sapiro has a side effect known as spontaneous tendon rupture. Imagine, I'm walking down the road, I'm on this antibiotic, all of a sudden my tendon ruptures and my medical bills skyrocket through the roof, and I'm now in surgery, I'm now in physical therapy, I'm now on crutches for months trying to heal this injury caused by an infection. I want to take you back to when the British came to North America Do you remember learning in history class about how the Indians, a lot of them died of chickenpox because the British brought it over? We are doing a very similar thing with antibiotics. We are not allowing our bodies to build up immunity to these illnesses. Rather, we're running to the doctor for an antibiotic. The Indians weren't immune, therefore, the Indians died of chickenpox because the British brought them over. We need to stop doing this. We need to stop taking them because we're harming our bodies. We're not building that immunity. We need to build that immunity because our body is the best protection against illnesses. There is an illness known as C. diff. It is actually a bacteria in your stomach, and according to the Livestrong Foundation, the antibiotics kill off a lot of the good bacteria as well as the bad bacteria. However, C. diff does not go away, and it takes over your stomach as the good bacteria leaves your body. Therefore, it gives off toxins the more you get in your body and creates another illness. Now, the antibiotics that were used to treat one illness have given you another illness. Because the benefits, they really aren't worth the risk. Now I'm going to recap and tell you how I've persuaded you that antibiotics are really not good for us. 1, because we're creating superbugs where antibiotics won't work. 2, because antibiotics are not easily affordable. And 3, because the risk is really not usually worth the benefit. Of course, take antibiotics when you need them. If you're going to die of a bladder infection, take the antibiotic. But save the antibiotics for the times that you really need them. Don't waste them on unnecessary treatment. That's ridiculous. Take that next step. Think of yourself. Think of your kids. Think of your future. Do you want to live in that scary world where we don't have antibiotics? I sure don't. It is time to take that next step. And I urge you to take it. But will you choose to? Because now the choice is yours. And with that, I thank you.